All right, welcome to the Gut Reset Reintroduction. I'm Dr. Eric Snow. If you've made it this far, which you have, congratulations. You made it through 30 days of the Gut Reset program. I know it can be challenging. I've been through it. I've walked so many patients through it over the many years we have been practicing and seen really great results. So again, congratulations. You've earned this. Now, where we're at now is we are reintroducing foods, and this is the most important part, even for me clinically. This is where we really have to just pay attention, listen to our body, because this is the diagnostic part. Whereas we reintroduce foods back into our body, we get to see which ones we can have, which ones we can't have. So at this time, your gut should be completely healed are so much better. Inflammation has calmed down, and most of the time at this point in 30 days, you shouldn't have any symptoms. Now, depending how inflamed you are and how severe things are, you might not be completely cleared. Research that I have read and what I've seen in clinical practice is we do start seeing inflammation just continue to drop down, even up to the 6 month mark. But you should really notice some big changes here. So what we're looking for is as we reintroduce these foods, we're really looking for which ones are going to trigger your body, trigger the immune system, trigger inflammation, and these symptoms that you probably didn't realize were actually being caused by your food. And we'll have some resources to help you mitigate the symptoms. But we're trying to find out what foods are doing what, how much inflammation they are causing in your body. Some are going to be worse than others. Some you can have in very small doses. I can't have gluten, period, anytime at all. I can have a little bit of dairy here and there if I'm really wise with it, keeping really miscellaneous amounts with that. And then I have found, and many patients have found, when they're away from the stress, their body can actually handle some of the stress that the food causes. So you might be on vacation and you can eat quite a bit of dairy and you don't have any symptoms at all. I've definitely experienced that, and other patients have as well. Again, some are just completely off limits. Then we're going to find ones that are really problematic to your gut. So this is an exciting thing to learn, and it'll impact you for a lifetime. And so we want to really make sure that we're enjoying very nutritious gut flora, supporting and nourishing foods. So do you need to reintroduce? You definitely you don't have to if you just know that something is bad, and so you're convinced that this is a bad food. Um, Sometimes, with patients are like, we just don't even want to go down that road again because we kind of know. So, but you can reintroduce. So if you like the symptoms and you don't feel like an intro, you either can just put it off for a while or just don't do it if you're convinced and but just remember what that food can do to you. And sometimes I've seen it really takes the reintroduction. It takes that patient one more, bad experience with that food to be very convinced. And so when I got diagnosed with gluten sensitivity, it took a while. I'm going to say, right around a year is when I really got to where I was truly gluten free. When I first got diagnosed with it, I went for a while without the gluten and I felt better. But then I started to convince myself, hey, look, you're better now. You should be able to have some. And so I'd have some and I could tell a little bit, but it wasn't as horrible. And then so I'd eat some more. And the next thing you know, I ate myself right back into anxiety, depression, fatigue. And so that's how it goes with these foods. And it took me about a year. So this was, gosh, I've been gluten free 16 years or so, and just to learn, what, gosh, I didn't even know all the things that had gluten in them. I remember one time I was eating a salad with meatballs, and I just didn't even think, that there would be gluten in that. And then I had the symptoms, so I called the restaurant and I learned, hey, a lot of people put breadcrumbs in their meatballs. And so it took a while to learn and how to talk to waiters and servers, at restaurants, where to go, where not to go. And so that is part of the journey that we talked about. It's not a destination, but a journey. So you really have to learn a lot of this stuff. Um, so reintroduction is very important. And so food sensitivity tests do not necessarily bypass reintroduction. There are numerous ways your body can have an inflammatory response to foods. Many of them are a localized response, and they're not actually detectable in the blood in a food specific manner. And that's something that's important even when we decide to order these bigger food allergy panels, food sensitivity panels. I still have to tell my patients, we might have to do our own detective work as well. And so you really got to pay attention. You can't ever just hang your hat on any type of diagnostic test, even though they're very valuable, can actually be shortcuts and help you get there quicker. We still, when you're talking about the gut, the way the body reacts to foods, this is the gold standard. And this is many times how we find some foods that never show up on these tests. And so that's very important to remember. You have to pay attention. Again, it's good to journal this stuff because this is life changing. When I got off of gluten, it changed my life. I had learned to deal with a little social anxiety. It was always there. I don't think many people could tell, but that was one of the biggest surprises for me when I got off of the gluten. You notice some changes, in a couple weeks, in a month. But when I was off of it, for 6 months and then longer, my social anxiety completely disappeared. And so that was just profound for me. And I was so excited to learn that personally so I could share it with my patients and other people so that they could, get rid of these mysterious symptoms that are related to your gut ecology and food issues. But your 6 most inflammatory foods to reintroduce, and these aren't necessarily in a hierarchy of, eggs are worse than wheat, but eggs are a very inflammatory food if you're sensitive to it. Just want to say it again. I believe eggs are a superfood. I eat lots of eggs. I don't have any problems with eggs. A lot of patients don't have problems with eggs. However, when you examine the research and you look at bigger populations, when we study this, eggs is an inflammatory food for some people. Dairy, I would say, is, gosh, even if you don't have a sensitivity to dairy, it's such a mucus forming food. Most people find they just feel better and are healthier doing very little dairy products. And I do see some people, they really tolerate it really well. And so it is a very specific thing to your body. Tomatoes and nightshades are a big one. Again, I have trouble with eggplants. I have to watch for eggplant. When I eat eggplant, the next day I'm going to be sore somewhere, maybe like an old injury site, an old fracture that I got in high school playing soccer, a lot of scar tissue in my knee there that just starts to ache, and I never have pain with that. And so you'll start to notice your body has barometers, as I call them. You'll have these little telltale signs, okay, something was too inflammatory for me that I ate yesterday or the day before. But definitely watch out for tomatoes and nightshades, especially for autoimmune and different arthritic cases. Those can be huge for that. Corn is a big one. Soy is a big one. And then wheat products are huge nowadays. Our wheat's been hybridized. It's the gluten protein it's just larger. It's more irritating. So that's a big one to watch out for as we reintroduce. And so how to reintroduce? Number one, you want to keep the rest of your diet the same as during the gut reset. Number two, you want to start from a small amount of the reintroduced food and gradually increase the dose for a week to watch for delayed reactions. You just have to be patient with this, but it's definitely worth it. Try different forms from raw, cooked, fermented, egg yolk only, egg white only. And then you want to make sure it's only one food you're reintroducing at a time. For example, like just introducing wheat, not a combination, because you got certain products like even breads where we got a mix of different food allergens in there. So that can kind of be a little tricky, but do your best to try and make sure if it's possible, you just introduce one thing at a time. And then you want to write down any symptoms that you experience in your daily food journal. Number 6, if you're experiencing negative symptoms, stop the reintroduction, then go back into the gut reset until all that stuff goes away, and then reintroduce the next food on your list. So we have here is a reintroduction schedule. Real easy to follow here. Just you add that inflammatory food one at a time, increase the dose. We just reviewed that. And then over the next 7 days, you watch that. So this would be a good example for you to get a concept of that. And then symptoms to watch out for. Gosh, gut symptoms for sure. What I see though is the reason why some of these food issues go under the radar, even for GI doctors, is because you're not getting any gut symptoms. It's actually more body symptoms like inflammation, emotional things, irritability, depression, anxiety. A big one too, if you are eating a food, unless you just really did a really high carb load, uh, but you're eating maybe a sensible meal and you notice you're very tired after that meal, more than likely you just found one of your food triggers there. So pay attention for energy changes, respiratory symptoms. Histamine is a big thing. A lot of these foods will increase your histamine, especially dairy products. So check out for just phlegm in the throat, a runny nose, things like that. Skin breakouts are huge. I have come to the conclusion that 90% of the time, when somebody comes to our practice with a skin problem, they have a gut and a food problem. So watch for skin breakouts, acne, rashes, pain. Headaches are huge. You get a vagal response when the gut gets irritated. And I've seen that as a chiropractor. It's real easy just to say, hey, when somebody's having pain in their upper cervical area, okay, you just got to adjust that, clear it out, work the soft tissue, trigger points, maybe do some posture counseling. But some of these neck and spinal problems, muscle problems, are actually secondary issues from viscera that are getting inflamed or stressed, referring into different parts of the body. And so, real common, and a lot of y'all notice this. I have found one of the first symptoms of gut irritation from a food. It's actually tension right here in the back of your neck. So, a lot of our hard cases, migraine cases, the resolution has been chiropractic care to get the musculoskeletal cleared out, and then hey, let's find what the food trigger is, and then the mysterious migraines go away. So look for pain in the neck is a real common area too, changes in appetite, and again, mood changes. Anxiety is big for me with gluten. It is so just weird. I can eat the gluten, and the next day I can barely even look somebody in the eyes because of the anxiety and the nervousness. And so that was a real interesting thing for me to learn. But they can happen in a few hours or days after consuming the food. I'm going to say you're using this something in 3 days, but it can be up to 7 for sure, just the way inflammation works. And then just make sure you're including symptoms in your journal, and then record how bad they are on a scale of 1 to 10 so we can know what to do and when not to do. So when you experience food reactions, you stop eating it immediately, you let your body recover, let the symptoms subside before bringing in the next food. We don't want to just overwhelm your body. Have a inflammatory issue with this food and you're not even cleared, and then you do another one. That could get very tiring and be overwhelming. So let's be smart with it, not go too fast. Things that we find help with this: do a scoop of a product we have. It's called Turmeric Power. It's fermented and it works really well. You get a lot of these turmeric compounds that help with the inflammation response. Get in pretty quick, and then activated charcoal is good. That's good anytime you had some food issue, food poisoning. Take the activated charcoal, and then it'll help absorb some of that and get that out of your system. And hey, congratulations. I hope this is just really awesome for you. I hope it's blessing you. I really just want to hear the testimonies are going to come out of this. One of my biggest testimonies was getting diagnosed and learning about gluten. It changed my life. That's how powerful this program can be. It can be a game changer, a life changer. We've seen people put diseases in remission, chronic symptoms just go away. So this is a huge thing to understand about your body. This is a lot of material that you've learned, but just be patient, stick with it, keep journaling, keep listening to your body. And then even in the future, this is really good to do quarterly. I had an experience not too long ago. I used to just being healthy all the time, lots of energy, sleep really well, no pain, and I started to develop almost an asthma in my upper chest, and I couldn't figure it out. So I went through gut reset program, started journaling, and I realized, oh, it's this boxed almond milk that I was having at my mom's house. And so I pulled the boxed almond milk out, and those symptoms that were so mysterious just went away. And so I was having a new reaction to something new into my diet. And so make this a part of your quarterly regimen. This is how you practice good health and steward your body. Spring cleaning is good. Take a look at that. A lot of people are trying to, get in shape, for the summer. Or just use the spring as a point to get, cleaned up and lose some weight. So that's a really excellent time just to mark it on your calendar to do the gut reset program. So, hey, I look forward to hearing your testimonies, and thank you so much for being a part of our program.